Hello, my name is Dr. Dewan S. Raja. Today I will discuss about neurotransmitters. Neurotransmitters are very important for the function of central nervous system, for the function of autonomic nervous system, for the somatic nervous system. Neurotransmitters are very essential. It works along with the hormones. And we'll go through the questions and answers. We have many neurotransmitters. We'll just give emphasis on in the most important neurotransmitters. So let's start. What is the definition of neurotransmitter? A neurotransmitter is a chemical released by a presynaptic nerve to cause excitation or inhibition of postsynaptic nerve or muscle. So neurotransmitters are also released in the neuromuscular junctions and also in the synapses between the nerves. What is the most common excitatory neurotransmitter in the central nervous system? That is glutamate. What is the role of glutamate in Huntington's disease? Here there will be glutamate. Here there is glutamate excitotoxicity is thought to be primarily responsible for the Huntington disease that affect the basal ganglia. What is the role of glutamate in seizure? Glutamate plays a role in kindling-induced seizure. Okay, here is the presynaptic vesicle. Neurotransmitter is released. This is the receptor side, the postsynaptic cell. Okay, we also need the calcium gated channel to be okay. Okay, then we should have an enzyme here so that the acetylcholine should be broken down after a certain time. Okay, so this presynaptic neuron at rest, here active presynaptic neuron, here it is very much active. What is the most common inhibitory neurotransmitter in the central nervous system? That is gamma aminobutyric acid. Which drug act in gamma? There is the gamma aminobutyric acid. Which drug act in the gamma aminobutyric acid 4 receptor? These are the anxiolytic benzodiazepine drugs like diazepam, Valium, or chlordiazepoxide. These are the anti-anxiety drug. The drug act on GABA A receptors. Which drug act in GABA B receptor? Baclofen, that is a antispasmodic medication. What type of poisoning blocks the glycine receptors? There is the strychnine. What is glycine? Glycine is widely distributed inhibitory neurotransmitter, highly concentrated in the spinal cord. What are the amino acid neurotransmitters? There is glutamate, GABA, and glycine. Remember 3 G's. What are the amine neurotransmitters? These are the acetylcholine, histamine, serotonin, catecholamine. What are the catecholamine neurotransmitters? Dopamine, norepinephrine, epinephrine. Also called noradrenaline, adrenaline. Increased activity of which neurotransmitter is associated with schizophrenia and psychosis? There is dopamine. Decreased activity of which neurotransmitter is associated with Parkinson's disease? Okay, that is the dopamine. What is the role of dopamine in psychiatric condition and impact? Answer should be dopamine activity is associated with brain's reward system and in addiction. What is the therapeutic application of dopamine agonist drug? To suppress pituitary tumors. What are the distribution of dopamine in the central nervous system? Substantia nigra, very important, in the midbrain section. Medial, mesencephalic, tegmentum, and hypothalamus. What is the distribution of serotonin 5-hydroxytryptamine in the central nervous system? It originates in raphe nucleus that is present in the brainstem, widely distributed to basal ganglia, limbic system, hypothalamus, cerebral cortex, and the intestine. Okay, basal ganglia, group of ganglia present in the cerebrum. Okay, and origin of the serotonin is raphe nucleus that is present in the brainstem. So, what are the psychiatric condition and impact of serotonin 5-hydroxytryptamine? Increased 5-HT associated with psychosis, decreased 5-HT associated with depression and anxiety. This is important. Low level of 5-hydroxyindole acetic acid, a metabolite of 5-hydroxytryptamine, is associated with aggressive and suicidal behavior. This is a byproduct of this. What are the psychiatric conditions and impacts of norepinephrine? Originate in the locus coeruleus, again in the brainstem. Increased activity causes anxiety, decreased activity causes depression. What are the psychiatric conditions and impacts of acetylcholine? Memory deficit and dementia. Dementia means not only memory deficit, also person has cognitive dysfunction. They're very common in dementia. And they also lose the judgment capacity. Okay, it is found in Alzheimer's disease. What are the examples of neuropeptide neurotransmitters? Like substance P, endorphin, encephalin, vasopressin, and oxytocin. We have a lot of other hormones. We have not covered that part, like that of nitric oxide, like that of carbon monoxide, like that of ADP. Those are also neurotransmitters. Okay, here is important. We must remember we have the somatic nervous system at the periphery here, and the somatic nervous system. This is the parasympathetic nervous system. This is the sympathetic nervous system. We have to find out the neurotransmitter. Okay, this is the preganglionic neuron here. This is the synapse, postganglionic neuron here. Okay, so here the acetylcholine is the ACH, parasympathetic nervous system. Both presynaptic fiber and postsynaptic fiber. Neurotransmitter is ACH. We'll go to the sympathetic. Again, the preganglionic fiber releases acetylcholine like this. In case of sympathetic nervous system, nerve going to the organ, here we'll get the norepinephrine, postganglionic. Here preganglionic acetylcholine, postganglionic is also acetylcholine. Okay. Here is sympathetic nervous system, again acetylcholine. Here also acetylcholine will get in the sweat gland. Okay, the sweat gland will get acetylcholine. We have the adrenal medulla that may produce some type of tumor like pheochromocytoma also. This part may go through tumor. We have high level of ACH and epinephrine. Okay, this is the somatic nervous system. Here the motor neuron is here, cell body is here. We have no synapse here. We are not seeing preganglionic, postganglionic fiber. There will be release of acetylcholine to the skeletal muscle at the neuromuscular junction. And that's all about the neurotransmitter. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.